of this webinar. All right. Very good evening to all of you. Thank you so much for joining us for this is today's important topic. And the topic is somewhere related to men's health, men's pelvic health. So far, most of us, we are thinking as a rehab therapist also, and as a community also, in this community, everyone is thinking that some issue related to the private health is only there for female. But these issues do affect men's, and they also affect those kind of issues like we can say that bladder is there, sexual health is also there in male, rectal health is also there in male, so bowel health when we are concerning it. So there's so much in men's health also, and pelvic floor rehabilitation is equally important in male. So this concept we want to understand in through this today's free webinar sessions. And I'm so thankful to Dr. Himanshu Arora. He, being a male physiotherapist, he took this initiative that, Madam, always we are talking about females. Now, why not male? So let's take an initiation and let's take a step and let's, create this kind of awareness. So today's webinar is there because of Dr. Himanshu Arora. Thank you so much, sir.
Ma'am, thanks to you also.
Thank you for taking this initiation because not most more like no so many of people they are not thinking about it. So let's just try to shine out a little bit, spread some light on this important health which is affecting you, me, and everyone across in
बिल्कुल
the world. Okay. So, men's health, if you will just ask me that what is men's health? Men's health is somewhere which is there are some important organ which is only present in male. So that important organ we can say that which is making male unique is that they are having, their you can say their prostate is there. We have their scrotum, their testes, their penile strength. Everything is there in male body. So how this is related to the pelvic floor. So I have one model. Let me just pin my screen. All right. Let me adjust my camera a little bit. All right. So you might have heard about female body, might be seen it. So this is same way, this is the pelvic bone, and same way male is also having the pelvic bone. We both are having the same structure, pelvic bone. And these are the muscles which is present there. These are all pelvic floor muscle. And we can see these are two openings in female body. One is anterior opening and one is this anus opening, posterior opening. So if I'll just turn it down like that, so this is all one hiatus or opening in a female body. And through this opening, female urethra is passing, and as well as female vaginal canal is also passing. So let me create some organs for more understanding. So these are important organ in female body actually. So this is uterus, this is the bladder, and posteriorly we are having this rectum. So all these three organs are passing through these pelvic floor muscles, which is working as the floor in female body. So let me keep that first organ, which is bladder, second organ, which is uterus with vagina, and the third organ, which is anal canal or rectum with the anal canal. So all of these three are passing through these structures you can see here. So this is a female pelvic floor. Urethra is passing, vaginal canal is passing, and anal canal is also passing. Three canals are passing through these hiatus. So two hiatus is there in a female body, and three organs are present in a female cavity, pelvic cavity. So this is all we are so far aware about. Now let's talk about male body. So when we say male pelvic floor, so male pelvic health, so the same we are having pelvic bone. And this pelvic bone on the bottom of this pelvis, they do have this pelvic floor muscles, which is quite strong muscles present here. And outside, if you see, these muscles looks like this. So quite strong muscles. And into this, male hiatus, they don't have very big opening as compared to female because female hiatus is quite big. two different organs has to pass. So a baby has to come out actually in a woman's life. So this is the bigger opening in a female body, but in male, this opening is not that big. It's just small openings are present. One opening is this one for urethra. Urethra is passing from this, and another opening is this anal. So bladder and bowel, their canals are passing through these muscles. So muscle is quite strong as compared to female, but muscles are present. So now if we see that male organ, so this is a male bladder and this is a female bladder. So bladders are somewhere, this is a coronal section you can see. So males, the bladder is somewhere similar, but female has the female bladder has a urethra, and urethra is quite small, around 4 centimeter long urethra. But male urethra is approximately 17 to 18 inch, very large, long urethra is there. And the urethra starts from the bladder, and we have another organ present just below the bladder, and that is prostate, and which is very important organ for male reproductive health. That produce some liquids and some kind of liquid which protects the sperm. So this is very important organ, and through that organ, the urethra is keep going downward, and this is going to become like prostatic urethra. And after that, this is a male penile structure. So you can understand this is how it is passing. And after that, we have these muscles coming. These are all pelvic floor muscles, which is attached with the base of penis. And then we have all the penis going on downwards. So penile structure is also, so many muscles are present at the base. And these muscles are pelvic floor muscles. And not only this, these are the muscles which is present externally, but this whole penile structure, now this is where the muscles are passing. As soon as the urethra is coming from the prostate, this urethra is going to now cross from the pelvic floor muscles. So this is how the organ is present. You can see bladder with the prostate. So after that, the urethra is passing through the pelvic floor muscles. That's how urethral health or bladder health when we are talking about. So if those muscles are weak, male can also have urine leakage issues, or might be frequency of urination can be high. It can be that painful urination, voiding dysfunction. So if the muscles are tight. So if the muscles are tight, they can give you pain during urination. If the muscles are weak, they can give a male also a frequent urination or leakage issue as well. So same thing are happening in both the gender. So if muscles are weak, both the gender can have leakage issue. If the muscles are tight, both of us, we can have a voiding dysfunction. So the important for the muscle is better health of this muscle, good health of this muscle. Muscle has a tone, and the tone can be sometimes hyper and it can be hypo. So many of the factors, they can affect the tone of this muscle. So you can understand that bladder health is important health. Not only the bladder, the prostate health is equally important in male. So there are so many muscles which is attached with the prostate. We will discuss about that as well. Then we have rectum at the back, and rectum, we all know that functioning of the rectum. It keep collecting the stool, all this excretory product of our body, and it keep collecting that into this area. And after that, we have to go for defecation once or twice in a day. So through the anal canal. So this anal canal is also passing through these muscles. So we have very strong muscles around the anal area. We call it, you can see the width of this muscle, how strong they are. So they are circular muscle fibers, and approximately 3 to 3.5 centimeter, you can say the width of these muscles are. And we are calling them as an external anal sphincteric muscle. So muscles are there around the penile, muscle penis structure, bulbocavernosus. Muscles are around prostate, the rhabdosphincteric muscle, and the muscles around anus also, external anal sphincteric muscles. So every organ which is passing through this area, the muscles are attached, and muscles are responsible for their optimal functioning. So they are helping us in, all this organ can do their good functioning. If you want to hold urine, the muscles will help us in contracting. So the muscles will contract and they will maintain the continence. During our sexual functioning, a male wants erection. These muscles will create a very good pumping so which can lead increase the blood flow towards the penile structure or a clitoris in a female body also. So these muscles are also present, ischiocavernosus muscles. They do the pumping. The way the calf muscles are doing pumping, the same way the ischiocavernosus muscle or pelvic floor muscles also do pumping, and they improve the blood circulation towards the penile structure. So erection can happen. And after the erection happens, erection should sustain. So we have another muscles like bulbocavernosus muscle, which is working as a ring around this penis. Let me show. These are the bulbocavernosus muscle. You can see one side. So the whole downward part, penile structure, is grabbed by this muscle and circled by these muscles. So these are bulbocavernosus muscle. If these muscles are strong enough, they have their strength, they will help in maintaining the blood flow into the penile structure. It means they will sustain the erection or in a male life. So you can understand that not only they are helping into moving the blood, pumping the blood into the cavernosas, into the chamber, so erection can happen even after the erection. Sustaining the erection is equally important, and that is also done by these muscles. So if these muscles will start getting weaker, male can see those kind of issues, erectile dysfunctions, which is very common. So same way, the muscle has a role. So we as a physio, we should understand our male sexual health also. So this kind of issues, this kind of discussion are not normal. People are thinking they are taboo, they don't discuss it very frequently, and even if they want to discuss, awareness is also not there. They very few people they understand that pelvic floor muscles can be also equally important, and they might be culprit if they are having those kind of issues. So what we can do now, the good news over here is that nowadays we as a pelvic rehab therapist, as a physiotherapist, we can help a people in normalizing the issue by creating the awareness into the society that pelvic floor health, if you are suffering from any pelvic floor issue, so you can definitely consult us. And most of the men, they are living into embarrassment. Like sometimes they feel embarrassment also whenever they are having urine incontinence of erectile dysfunctions. And it is kind of muscle of these muscles are what I will say it's a muscle of manhood. The same way these muscles are muscle of like feminine, better feminine and reproductive health in a women's body. Same way, these are the muscles of manhood also. So only training the abdominals, only training the biceps, another important thing in the body is training the pelvic floor muscle, because they can sustain, they can maintain the erection, they can create erection, and they can sustain the bowel and bladder better functioning. So it is very important that we as a physio try to come forward and try to understand these muscles. Like, is it a one muscle, two muscle, group of muscle? How many muscles are present there? And whatever muscles are present there, how they can do the functioning. Each muscle has its different role in different functioning. So that understanding is very important. Same way, urine incontinence is also embarrassing. A fecal incontinence also embarrassing. Continuously pelvic pain. If something happened, because every muscle is wrapped up in a facial sheet. If something happened to the fascia of this muscle, some kind of scarring, some kind of adhesions, they can keep giving deeper pelvic pain. Chronic pelvic pain is commonly affected issue which is there into the society. Most of them, so many of the male, they have this kind of all the time, some kind of tension, some kind of tenderness inside. They are feeling around the pubic region, around the anal region, somewhere this kind of tension they are always keep feeling. So you can understand this tension can be due to the tension and due to this adhesion, and trigger points might be for or the tension and tightness into pelvic floor. So we should understand that if the trapezius can get spasmodic, pelvic floor muscles are also same skeletal muscle. They can also get spasmodic. So the way we are treating trapezius, the same way we can also treat these muscles. But the difference between trapezius, it is an external approach we can do. But when we talk about the pelvic floor, these muscles are lying inside the body. And unfortunately, this area we are not discussing very, very commonly. It's a kind of somewhere shy and silent area of our body. And when these muscles are staying there into the pelvic region, so the issues are most of the time ignored and unaddressed. And they think that they just have to take this sometimes painkillers or some might be some medication, and they're just going here and there. But relaxing of the muscles is something which is ignored. So we as a physio, we should try to kind of create this awareness that if you have any pelvic pain, if you have any pain during urination or even the defecation and even the sexual activity, if the pain is there, so pain is never normal. Pain is good because it is sending signal to your brain that something is wrong. But at the same time, why to live with the pain? We can help by understanding that, by relaxing that as a physio. But this awareness is not there. Lots of sexologists, urologists, they are doing their work, but this pelvic health, pelvic floor muscle is somewhere not that much of normalized in everyone's practice. Even they are not aware about that. Or this kind of widespread role of the pelvic in male life. So this is what we are going to discuss in today's session. So for that, I have a small PPT. So let me just take you through the PPT and try to give you some kind of visualization of these muscles, that how important is this. So you can see this is a beautiful image of a male pelvis where these pelvic floor muscles are seen around this pelvic bone. So you can see this is covering the floor of the pelvis bone. We all are aware that these upside where my cursor is moving, and let me take some pen also. So where this part, this is all pubic symphysis of a male. And then we have this coccyx at the back. We have ischial tuberosities on this side. So this is all pubic rami, ischium rami, everything. We understand this bone. Now the bottom of this bone, if I just turn it down like that, so everywhere this whole outlet is covered by these muscles. And that's why we are calling that these muscles are creating floor of the pelvis. So these are the pelvic floor muscle. Now, all these muscles are visible in this. You can see that, this is one muscle going on upside. This is also going on from ischial tuberosity upside. And we have this penile structure here. So this is all penile structure. So many muscles are wrapped. So this is one muscle wrapped around the penile structure also. So this muscle, which is following this ischium, is a ischiocavernosus muscle. Cavernosa means cavernosas are small chambers present inside that penile structure, penis. So we can say that cavernosa means something related to the sexual health. So the muscle which is attached with the cavernosa and coming from the ischium, the name is very simple. Ischiocavernosus means coming from ischium and going into the cavernosal organ means penis. And these muscles are going to help into increasing the blood flow towards the penile structure when the male is aroused. So they help into erection. If these muscles are tight, so you can understand male will feel pain during arousal or during erection. So if these muscles will be weak, so male might not have erection. So because blood will not be able to pump up upside if muscle strength is not there. So male can have erectile dysfunction. Same way, another muscle is present, these one, bulbocavernosus. We also has a bulb of the penile structure as well as the cavernosas. They both are the structure of the penis. So the muscles are around the bulb of the penis at the lower part downward from where the root of the penis starts. And they are working like a ring. So if this is a penile structure, so this ring is like a bulbocavernosus. So bulbocavernosus muscle help in that space. When you say that whole penis is filled up with blood, at that time this blood should not drain down towards the heart. So we need to create a compression over the veins, because arteries are bringing the blood, veins are taking the blood back. But these muscle, if the muscle strength is very good, they will create a tension create a contraction, and good contractions are going to help in create a compression over the veins. So you can understand vein will not be able to take the blood back towards the heart, and this is going to prevent the venous draining. It means whatever erection has happened, that erection is going to stay for till the time male wants. So this is very important part of male sexual functioning, and these are important muscles. So this is we have two separate muscle in female, but this is one muscle which is wrapped around at the base of the penis, and very important muscle. Everyone who has erectile dysfunction, we should always consider this muscle equally important as the blood is sending as the heart is important. Same way, if the heart is working good, if arteries are functional, veins are functional, this muscle should be also functional. If this muscle is not functional, it don't have strength, so definitely you can understand now how erectile dysfunction can happen. And even if these muscles are tight, or they have some kind of tender points or some kind of trigger points into these muscles, so that can lead to some sexual pain during that erection or maintaining the erection. Male will not be able to maintain, and we can understand these two muscles jointly are helping a male in sexual functioning. Okay, and sexual functioning, when we talk about, so sexual activity is a pleasurable activity. It should not be painful activity because of the tightness into the muscle, and this should not be even embarrassment activity if the erection is not going on. So this health can directly impact a man, manhood actually. That's why these two muscles are muscle of manhood, and they are equally important, or like every muscle of your body. You can understand abdominals. People are doing abdominal workout. Now try to think about your male population who are spending hours into gym, and they are training their biceps. They might be training their abdominals. So they are doing the training of all the muscles, but they never train the important muscles, which is important for their sexual health. So try to understand this muscle as a physiotherapist point of view, and understand that what we can do, what we can add in people's life, confidence, painless, they kind of easy, painless kind of sexual activities. So we can help them. And these muscle penile structure is present in male. So these muscles are very, very important. Same way, you can understand that downward here, we are having anal structure. So now around the anal, we have external anal sphincteric muscle. So you can understand throughout the day, rectum is collecting the stool, and stool should be able to come outside whenever the urge is there. Male wants to pass stool. So these muscles, which is around the anus, they should not be tight. If these muscles will be tight, you can understand that opening of the anus will not be there. And if opening is not there, so passing of the stool can be difficult. So it can create defecation issues if these muscles are tensed and tight. And if these muscles on the other way, if these muscles are weak, loose, so you can understand that passing of the stool, or kind of, you can understand passing of gas also, they all can be due to the weakness into these muscles. Now, out of this pelvic floor, external anal sphincteric muscle, or this muscle around the anus, is one of the strongest muscle. So we really want to hold our stool in a place. So you can understand not only the stool, bowel, we have so many veins around the anus. All the arteries are bringing the blood, veins are taking the blood back towards the heart. So many veins are there, and this is the end part. So gravity has a big effect onto those veins. So if these muscles are strong enough, they will create a compression on this last part of the veins. And due to the compression, venous return towards the heart will be always good. And in this case, you can understand circulation will be maintained. But if these muscles are weak, so they will fail to create a compression over the veins. If the veins will not get compressed, the venous return will be somewhere going to affect. And as well as the veins are going to continuously, they will be under the effect of this pull of the gravity, and veins might start protruding outside. So this protrusion is nothing. It is the same. You might be understanding with me now. It is same piles or hemorrhoids. So hemorrhoids and piles, the same name. It means protrusion of the veins. Now, why the veins are protruding out? Why they are falling outside? Because the one reason it can be that these muscles which is present there, they fail to create a compressive strength and force over that vein. So venous return is not happening. Veins are always filled up with the blood and gravity is keep pulling it downwards. So anal pressure will also not be maintained. So this is very important functioning of this muscle, maintaining your continence, fecal continence, as well as helping venous return. So we can avoid piles and hemorrhoids. Believe me, 80% of population nowadays they have piles and hemorrhoids. And the weakness can be the reason. Weakness of these muscles can be the one of the reason. We can understand that there can be other reason also, like defecation all the time. If the constipated stool, the hydration is not good, liquid diet is not there. A lot of you can understand tight stool is there. So if the tight stool is there, hard stool is there, might be male or female. We try to apply a lot of pressure, defecation pressure during that passing the stool. So this continuously defecation process, pressure can also create a weakness of these muscles. So muscles can get weaker on a longer run. If muscles will get weak, so that can definitely going to give us weakness related issues. It can be hemorrhoid piles, or it can be also, you can say that leakage of the stool. So yes, these muscles are, this functioning is equally important in both the gender, male and female. So we should not think that pelvic floor muscle role is only there into male, or it's healthy or only in the female, or its health is only important for female. Equal importance of these muscles are there in male too. And so this is very important muscle. And second, you can say this one muscle is coming. Let me show you another organ, because now when we are talking about the organ, so we should try to think about organ most of like in this. Okay, let me, what happened? Six scribbling, so we need to erase. All right. You can see that, yes, these muscles are important. And let's talk about another organ, which is equally important, like our prostate, male prostate. So these blue color of muscle, we are calling them as a rhabdosphincteric muscle. This is what the name of these muscles are. This one. So these muscles are very important. You can see that they are all coming from that side of the ischial rami, and they are traveling towards the, from the lateral side, they're traveling towards the prostate, and they encircle around the prostate, encircle around the urethra, and they merge at the posterior part of the prostate. And after that, they are going into the perineal body. So there are so many different names might be I'm using right now if it is new for you. But this is what it is actually. So this is what the prostate, this is how these muscles are wrapped around the urethra, and with the prostate, they are merging it. So you try to understand what will happen if these muscles will get weak, because these muscles are around the urethra. If these muscles are weak, so male can have urine leakage. And if these muscles are tight, male can have pain during urination. Okay, and that can lead to kind of voiding dysfunction, painful urination. If the muscles are weak, it can lead to frequency, like urine incontinence, and might be frequency of urination can be also high in those cases, because when you have leakage, also dribbling of urine can happen. But when you are having urination or voiding issues, you might keep trying to go for again and again for passing the urine, and it will be incomplete voiding sensation. So those kind of issues can affect the male, and that can not only the male kind of personal, even the social life also it can affect. You can freak a lot of time if you are keep going on to the washroom because you are feeling this kind of incomplete urination. It might be painful urination. You might be suffering. Male might be suffering in silence. Actually, they don't. They think that I don't know why urine is not able to pass out, and they might try to manage it. But there can be these muscles attached with that. If these muscles can be tight or this muscle can be weak. So they are again equally important. You can understand they are and wrapping around the urethra as well as the prostate. Now, this when we use the word prostrate. So try to understand here. In those cases, when prostate is going for inflammation or might be a large prostate is there. So in like kind of the oversized prostate due to some conditioning effect in male's life. So whenever we have prostatitis, means inflammation of the prostate. So how it can affect? These muscles can also get inflamed. If they will get inflamed, they will get tensed. It can give pain during the urination. So in case of prostatitis, because they are attached with the prostate. And if there's a large prostate is there, enlargement of the prostate is going on, so these muscles can become large, lax, loose. So they will not do their functioning in creating that, good compression and contractions around the urethra, and it can lead to dribbling of urine, continuously dribbling of the urine, or urine leakage that can equally happen in male. So these are very important muscles which is attached with the urethra as well as the prostate, rhabdosphincteric muscle. Now these muscles, where they are present into the middle layer of the pelvic floor, and you can understand their function is maintaining that continence as well as the prostate health. Same way, try to understand whenever there is a prostatectomy they are doing, they remove the prostate in male case. So whenever prostate is being removed, so what will happen to these muscles, the muscles which is attached with the prostate? So we are going to have we will miss those muscles. They will also get cut with the prostate. So that kind of you can understand the effect will be there onto these muscles. So less number of prostate will be there because half of the prostate will be removed from half of the prostate muscles which is attached with that might be removed. So that is again going to lead to urine incontinence after prostatectomy. And I have seen so many of my patients who are complaining having the urine incontinence after prostatectomy. And you might be also aware, and you can just write down on Google and search out how the urine incontinence is very common after prostatectomy. So now you can understand why, because of the lack of these muscle fibers, which might have been removed, and which might have not only the lack of this muscle, it can be that after these surgeries, there might be stitches of those areas, scarring around that areas. Those kind of scarring can lead to tension and tightness around the urethra also. So again, difficulty in passing the urine as well as you can dribbling of the urine, continuously dribbling of the urine. So they are so important in our life. So this is very 1 second in inner muscle. You can see here also. So this is how they are creating that kind of good compressive strength around the urethra as well as the prostate. They're working, they're like you can say they're a kind of sphincteric. It's like a closed door around this both important organ, urethra as well as that prostate. So very important these muscles are. And now these muscles are supplied by pudendal nerve, pudendal, which is coming from S2, S3, S4. And after these muscles, very inner, very inside, you can say deeper muscle of the pelvic floor. You might have heard about this name, levator ani. So there's another muscle, not one muscle, actually, there are three muscles. Three muscles are all together into the deeper layer. And levator ani is one of the part. So this is very internal part you can see from here. So deeper side. So now in these inner side, you can say this part is going to this is one area which is going to come in a direct relation with the organs. So the organ, when we talk about, like you can say that bladder. So bladder is resting onto these muscle. So if this is a bladder of a male, so this bladder of the male is going to come in direct connection with this muscle. So this pelvic floor deeper layer are supporting the organs, bladder of a male, prostate of a male, as well as you can say that rectum of a male. Rectum is also situated here following this whole shape of the sacrum. So rectum. So these muscles are supporting. So these muscles are same like right now you, me, we all are sitting into this room where you are, and the floor is having there. No, the room is having floor. So the floor where your legs are or where you're sitting, this floor is the levator ani, deeper layer. So we are resting on the floor. And if we are having canals, like you can say urethra, or we are having this anus, so these canals are going to pass through the floor. So this is how the floor is supporting the organs. Like the base, wide base of the support is there, which is going to keep supporting the organs. And they are going to keep maintaining this, elevation, because ascending kind of, this pelvic floor muscles are high toned muscle actually in our body. So they always have this kind of higher tone. So 70% of slow twitch muscle fibers are present into levator ani. And these muscles are keep creating this ascending and upper kind of, trampoline like kind of effect, always upside elevation. So whenever the muscles are doing elevation, whatever muscle is doing this kind of elevation because of their more number of slow twitch muscle fiber, we can say them as an elevator, or this is what the name comes from, levator. So this is the inner deeper layer. So if these muscles will become weak, so you can understand the organs can start descending down. You might have seen in female, which is very visible sometimes, pelvic organ prolapse. Uterus is falling out. It can be bladder is falling outside, rectum is falling outside. So you try and this kind of prolapse are very common. Same because the muscle fail to support the organs, and instead of ascending, they keep descending downward. So whenever this muscle is not strong enough, the gravity will keep pulling it more down. There might be more factors like you can understand obesity is there, more intra-abdominal pressure is there, any activity which is increasing the intra-abdominal pressure, they can all lead sustained pressure, continuous pressure onto this pelvic region, pelvic organ, and that can keep creating the weakness into those muscles. So intra-abdominal pressure as well as the strenuous activity as well as you can understand gravity, they all can keep affecting the tone of these muscles, and it might fail to support this kind of ascending nature, isn't it, or supporting of this organ, and that can lead to pelvic organ prolapse or descent of the organ. It is also common in male. So in female body, organ can descend from the vagina, but in male body, organ can descend from the rectum. So it can be anal mucosa is falling down. So that is again prolapse. It can be that piles is coming out, that veins are coming down. So it is again a prolapse of the veins. It can be the prostate is falling downwards or descending downwards, or rectum is descending downwards. So that can be supportive functioning of the levator ani is affected and can lead to this kind of weakness. It can be there in male also. Now, so these muscles are very, very important to help this kind of, supportive action. And if these muscles are tight or tensed, so what will happen? So this kind of tension all the time into the organs, assume that you are sitting and something is pushing you upside, or always there's a tension from the down. So that tension can lead to kind of deeper pain into the pelvic region. And we can say that it can be acute or chronic both. So chronic pelvic pain syndrome, so many years I'm having this kind of tension into my pelvic region. So in that case, whenever the tone will be high or over tight, so you can understand that tone can affect bladder, that tone can affect prostate functioning, that tone can affect urethra, that because urethra is passing, so urethra can be compressed, that tone can also affect rectum. It can affect the puborectalis muscle is there, that can become tight. So passing of the stool can be, or descending of the stool can be very, very difficult. It might keep us creating ascending pressure over the large colon, and male might feel some kind of all the time, you can understand blotting into the abdomen and those kind of gas-like sensation inside the abdomen throughout the day, or might be feeling difficulty in passing the stool also because muscles are very tight. And if this kind of tension tension is there, so you can understand that this, what you can say, back pain. There is a, because muscles are attached with the coccyx, it is attached with the sacrum. So if tension is there, they might create a tension around the sacrum. They might create a tension around that whole pelvic bone, complete anterior to posterior. Male can start having pain around the pubic, from the anterior to posterior, pubic symphysis, ilium, and the whole complete, you can say that inlet of the pelvis can be tensed and tight, and can definitely give painful urination, painful defecation, painful sexual activity, continuously back pain, or might be a lot of bloating. So it means ascending pressure will be always high. And if ascending pressure will be high into the pelvic region, that is going to create a ascending pressure in the abdomen that can affect the abdominal, the whole core muscles, back muscles, abdominal muscles, as well as this ascending pressure can give you the bulging abdomen. It can give you tension over the diaphragm. Diaphragm will be more dome shape. It will fail to descend downward. So you can understand this pelvic pressure can increase the abdominal pressure, and that can increase that pressure over the diaphragm, abdominal diaphragm. It will fail to descend down. It can definitely affect the thoracic cavity pressure also. So in this case, male will feel a lot of congestion into the body at all the time, tension into the body. So relaxation will be somewhere hard for them to achieve. So one muscle tension can affect the whole system from down to up. So this is why these muscles are, playing a very important role. Now, when we say that core, so core is not only the abdominal, core is abdominal, all this cylinder completely, abdominal, anteriorly, lateral muscles of the abdomen, posterior muscles, your back, upper side we have diaphragm, lower side we have pelvic diaphragm, or these muscles, they are all working in a synchronization, then our optimal functioning we can achieve. If something happened to any of the muscle, that is going to affect the whole air pressure into the abdominal, pelvic, as well as the thoracic cage. So this is very important to understand that this one muscle is equally important. Like the abdominals are important, this muscle is very, very important. And after all, throughout the day, we are using those muscles. During our normal functioning of our day, urination 5 to 6 times in a day, we are relaxing those muscles. Then again, sustaining the tone throughout the day. We are relaxing the muscles around the anus also. We are using those muscles during the sexual functioning also. And continuously, they are creating the stability around the area. So we have very important muscles which is providing the stability of the pelvic bone. So these muscles are these ones. So let me just show you those muscles also, which is responsible for creating your stability of pelvic bone. So these muscles actually. Can you see these muscles which is coming from that ischial spine on one side, and they are going towards the let me show a clear picture to you. Can you see this one? This is ischial tuberosity, and from that ischial tuberosity, these muscles are coming from ischial tuberosity towards the center of that perineal body. We are calling it as a perineal body below the penis. So, and above the anus, this one connective tissue is there, and this structure we are calling it as a perineal body. So these muscles are going like that, and they are one side of muscle, other side of muscle. They both are going to create a stability, like they are both going to join at the perineal body. So they are maintaining the stability of ischial tuberosity. So you can see this one, these muscles are coming from here. So this is one ischial tuberosity, and this is another ischial tuberosity. These muscles are going to come like this, like my fingers are traveling like that, okay? So this is how these muscles are. So you can understand, we are calling it as a superficial transverse perineal muscle. Same way, we have a deeper transverse, another layer, another floor of this muscle is also there like that. So deeper transverse perineal muscle. So these muscles are providing a very good stability to your ischial tuberosities. So ischial tuberosity will lie in a right distance, and they will maintain this pubic arch angle. So this pubic arch angle is normally 70-degree in male. So this, it means the muscles are somewhere, because the structure of a male is very kind of narrow structures, longer, elongated, and narrow structures are there. So these muscles are coming from here to here. So you can understand the maintaining the whole distance or stability. The more this stability will be maintained, the better that sacroiliac health, or the whole joints will be there. So if these muscles will be tight, you can see here, so there can be SI joint pain, because whenever this muscle will be tight, this angle will be narrow. So it will be ascending pressure upside, as well as male can show you back pain. So this back pain, the distance between sacrum and ilium can become more if these muscles are tensed and tight. And if these muscles are loose, assume that they are loose, it means that angle will become wider. This pubic arch angle will become wider than 70 degree. So this loose muscle, so these loose muscles can create a descent down, or if again, if it will be outward, so we can say that can again give you back pain around this downward part here. So S3, S4 will be painful. That particular side will be painful. And that is going to create a narrowing of the inlet. So again, it will create a congestion kind of downward descending kind of pressure all the time into the pelvic region. So this whole pelvic bone is stabilized by these important muscle which is coming from the side, superficial transverse, deep transverse. Not only these, even another muscle is present from, you might be knowing that we have this ischial spine inside, isn't it? This ischial spine. This one. So from ischial spine to sacrum or coccyx, another muscle is going, ischio-coccygeus muscle. So this ischio-coccygeus muscle is very important to maintain the stability between ischial spine as well as the coccyx. So you can understand how important these muscles are. It is not only pelvic floor muscle is not only one muscle, they are group of muscle. So many of muscles are present. They are coming from right side. Our whole body is like right and left, isn't it? Same way the pelvic floor muscles are also right and left. They are coming, joining together into the center. Through the center, the canals are passing, urethra, as well as you can say that anal canal in male body. So these muscles are encircling around the urethra, working as a urethral sphincteric. You can see that this rhabdosphincteric, how they are creating encircling around the this prostate and the urethra. Then the penile muscles are also encircling bulbocavernosus. Now external anal sphincteric muscles are also encircled around the anus. So they create a compression around the important organ of a male. They provide a stability to the pelvic bone. They help into sexual functioning. The levator ani helps into creating the good tone and has support to the organs. And you can understand that these muscles are doing fantastic job when they are working into synchronization as well as the coordination as per the brain. So there is so much is there in male pelvic health. Now you can understand very simply that bowel health, bladder health, sexual health, as well as the back health also. Back health is equally. We keep treating a male who has male or female. We keep treating them for back pain whenever they are coming to our clinic. We never address these muscles, which is equally maintaining the stability. If these muscles will be hypertensed, very loose, they can directly going to affect SI, going to give that kind of continuously pain around the sacroiliac joint. Around it can be upper side or lower side. So they are muscle of stability. So this is how pelvic floor muscles are doing fantastic job in our sexual health, in our sphincteric health, means closing and opening during the urination, defecation, even ejaculation of the semen. Muscles are relaxed, then only the better ejaculation can happen through the penile structure. So they are doing their sexual functioning, they are helping into sphincteric functioning, they are helping into this kind of stabilizing, they are helping into, you can understand, supporting the organ as well as improving the blood circulation, improving this venous return. So like you are having hurt and second hurt is calf, the third hurt, what I always believe, is pelvic floor. A more good working pelvic floor will keep doing better work for penile health, penile kind of blood supply, filling of that, filling into the cavernosas of the penile, as well as improving that very better good contraction over, you can say, around that veins, helping into venous return. So this is the 5 important function of the pelvic floor, and there are so many muscles, and muscles are arranged into layers: superficial, middle, deep. These are the 3 layers, and they are keep, every muscle is good. So many muscles are there. So, and some muscles will go into the they will support around the urethra, some muscles will go and support the prostate, some muscle will support that rectum, some muscle will support your anus, some muscle will support your ischial tuberosity, some will support your you can understand that coccyx. So coccyx also coccydynia might be something which we are looking. It's very common in our practice. So you can see that coccyx. What is this? This is a small tailbone, and we have this kind of angulation of this tailbone. Now, why? How this angulation is maintained? Have you ever thought about it? This angulation is maintained by the strength of the muscle, because these muscles are coming from here to there. So let me show you one image here, this model actually. So you can say that these muscles are pubic to coccyx. These muscles are going. So this all are they are all inserted into the coccyx. So what they do, the good muscle will keep pulling the coccyx little bit anteriorly, and then this kind of angle will be maintained. But if this muscle will become loose and weak, so they will fail to pull the coccyx anteriorly, isn't it? And in this case, what will happen to the coccyx? Coccyx will not be pulled anteriorly because muscles are not strong enough. I'm not strong enough to pull you anteriorly. So you will fall back. And once this is the when the coccyx will fall back, the tailbone fall back. So you can understand it will keep giving the patient tailbone pain, pocky pain. So this so coccydynia, stop treating the symptom of coccydynia. It is important that you assess this muscle. This muscle is weak. It failed to pull the coccyx anteriorly. So we need, this is again very important back health. So once it will fail to pull the coccyx anteriorly, so that is what you can understand, the tailbone will be continuously. So doing this ultrasound, TENS, cryotherapy, no, don't do that. uh, you can do that, but not only focus on that. It's important that you first check the strength of this muscle. If they are weak, and they are weak, then only that coccyx is falling backwards. So start strengthening the pelvic floor. So in those cases, and sometimes it is too much of tensed and tight. If the muscles are very tense, they will pull it anteriorly. The moment they will pull the coccyx anteriorly, you can understand, the moment they will pull it anteriorly, the sacrum can be also pulled anteriorly because of the tensed muscle, and that can again give the back pain to the patient. So they are directly causing a male some issues with the lumbar, sacrum, as well as the coccyx region, and creating that kind of pain around the back. So this is the importance of this muscle is. So my request to all of you now, let's start looking at our patient care with the different lens, like different lens of a physio, where we can also understand the whole body as a system. Try to understand the body as a system instead of just only focusing on to the symptom. So don't read the symptom. So just look up to back, up to down. So always you can understand if someone is doing a lot of inhalation, so too much of inhale they are doing, so that might be a lot of relaxation in the body going on. It might be always enlargement inside the thoracic cavity, descent of the abdominal diaphragm, kind of too much of pressure around that. When we are doing a lot of breath hold during the yoga, okay, so too much of breath hold, that can increase the pressure inside the body, that can increase the pressure of abdominal diaphragm, it can increase the pressure of the abdominal muscles, back muscles, it can increase the pressure of the pelvic muscles, it can give us weakness into our muscles. And too much of expiration, if someone is having shallow breathing, they are not doing inhale, so they might have the tension into the body, too much of tension and ascending pressure. So tension inside the pelvic floor also. So try to understand next time when your patient comes that, oh, let me just look everything, what is happening with the abdominal, thoracic, as well as the pelvic pressure. Okay, air pressure is very important to understand, to address, as well as pelvic floor. Don't ignore the pelvic floor whenever your patient is having weaker core or weaker abdominals. Weaker abdominals, there might be high chances of getting weakness into the pelvic floor, or weakness into the abdominal diaphragm, or weakness of the back also. So let's understand the whole body as a system. Let's try to explore more about the pelvic floor. This is what was the introductory session today. There is much more into pelvic floor. If possible, if you all are interested, or some of you are interested, you guys can, we can arrange online webinar series for you. There are not more pelvic rehab therapists in India, even in the world also, because we are not aware. It was not a part of our curriculum. So, but why to ignore it? The same way we are treating diaphragm, we are treating back, we are treating any of our muscles, we are doing the sports rehab. So you can think about it. Sports rehabilitation, when the male is athletic people who are keep loading their body, keep you lifting a lot of weight, might be doing strenuous activities. What can be the status of their pelvic floor? Okay, so let's try to ask important questions from our patient. Do you have any time pain during urination, defecation? Are you suffering from constipation? Do you have any time sexual pain? When your patient is having weak core, or might be they are having tight core, or they are having tight back, or back pain issues are there, okay? Or when you say you feel that they have a congestion, lot of congestion in their body. So they might also show you the tension around the bowel, bladder, and sexual health. And another side, when you found a lot of weakness into the system, so don't forget to ask, are you sometimes having kind of, leakage of the stool, or might be leakage of urine, dribbling of urine, or it can be piles or hemorrhoids, or erectile dysfunctions. So much we can add in our patient's life by addressing pelvic health. So it's just creating the awareness into the society and taking a step forward, that let's try to learn it. And there are so many books available. You might also found articles, publications. So much is there related to the men's health also. So let's stop ignoring men pelvic health, and let's learn it. And if you want anytime, if you want my help, we can definitely schedule complete online webinar series. You can understand my limitation also, because being a woman, being a female, I'm not that much comfortable in treating or doing that workshops, which is going to take this transrectal approach. But I can give you complete idea. So through the online also, 80 to 90% you will understand the pelvic floor, and 10% you being a male, you can do on yourself, and you will understand that. Okay, you can try. So it's very easy. It's just we need to just come forward. We should have that kind of approach. Now, my request to all of you, that stop looking at that area only as a sexual area. This area is very important for our sexual activities we are doing sometimes, might be once in a day, or might be 2 3 times in a week. So it is kind of, we are sometimes living without sexual activity also, but we are not living without urination. We are not living without defecation. We can't live without the supporting these organs, and we can't live with the pain, back pain. So these muscles are very important for all these others health. So instead of only sexual health, or thinking this area as a taboo, or like related to the sexual, they try to think about bowel, bladder, and the whole core, that approach. Okay, so that is going to take you a lot of load, that how to ask questions. Don't worry, just understand we are medical people, and no one is helping that population in this way, such way. Even urologists, they are dealing with their bladder, might be prostate. They're not dealing with the pelvic floor. They are not taking care of this muscles, which we talk today. The colorectal surgeon, they are taking care of the rectum, might be gut, they might be taking care of the anal canal, they might do your surgeries, remove your piles, hemorrhoids, but they are not bothered about pelvic floor muscles around the anus, external anal sphinctic muscle, puborectalis muscle. They don't know actually, because awareness is not there. Even they don't know that we as a physio can help them with their patients when their patient is having a, you can understand anal stenosis after having hemorrhoidectomy. When they remove that hemorrhoid, there might be stenosis, adhesions around that area, and the patients are living with it. They don't know that they can send the patient to the physiotherapist, and physiotherapist can relax those areas. They are not aware. Why they are not aware? Because we are not aware. We never went to them. We never went to urologist and told them that these are the muscles around that. They are already knowing that these are the muscles around that urethra, around that prostate, and they might get weak. If they are getting weaker, they might send their patient to us, and we will be able to help them in giving that best rehabilitation by adding our best rehabilitation in their care. In this way, this is what I use this word always, that we need to add this complete care in people's life, in our patient's life. It is not only urology and they did their But after that, after taking care of the urethra and the bladder, prostate, the pelvic floor muscle should not be ignored, because they are the door, and through that door, everyone is going in and out, but no one is taking care of the door. And this Kegel exercise, when we are using the word Kegel, so Kegel exercise is one part where we create a contraction of the pelvic floor. And when we can maintain the contraction, we can sustain the contraction, we can act like, we can ask the patient to create this kind of hold and squeeze. That hold and squeeze is only advisable when the muscles are weak. When the muscles are tight, we cannot advise these contractions, sustaining the contractions. So Kegels are not for tight pelvic floor. It is only for weak pelvic floor. But again, there is so much about the Kegel also. So that concept we will also understand some other day. We will arrange one session on the Kegel as well. And this was all about little bit of pelvic floor, which I wanted to share with all of you today, being a physio. And I feel that this is missing somewhere, and it should not miss, because we are all trying to help our patient from level best. So now let's add that as well. Why not? Okay, so don't feel shy. Always think, whenever shyness comes in your mind, always thinks it is not only about the sex, it is about bowel and bladder and the back, even everything, and these little muscles which is present here, working all the time against the gravity. Whenever we are standing and we are doing our work, loading our body, muscles are strained, muscles are somewhere they are working against those kind of in all these kind of functional activities. So let's add pelvic floor rehabilitation in our life, and not only in women's life, it is important, equally important they are in men health. So this was my small webinar regarding to related to this men's health and men's pelvic health. So to all my male friend, please come forward, learn it. Whatever I know, I will definitely try to help you all. And otherwise, I don't know whatever the approach, but please don't ignore it. It is very important. Believe me, 40% of male after 40 years, they have erectile dysfunction. 50% of male after 50, they have erectile dysfunction. So many of people, male, they are having premature ejaculation. So these two small muscle can affect, okay, this bulbocavanosis, ischocavanosis, and the whole pelvic floor if the strength is not good, perineal muscle strength is not good. 80% of people who are obese, they have piles and hemorrhoids. 80%, 50 to 80% of people, they are having constipation. So many people are having stool incontinence, they have back pain issues. So please help them, okay? And if you need little bit of exercise, so exercise is like Kegel exercise or things like that. So I have some of videos, so I'll share with you. You can just in the group itself where you get your link, I'll try to share a little bit of information whatever I have in the group itself, okay? Men, can varicocele be treated or made better by physio? Yes, dear. We can do by creating the better circulation of these muscles when they are doing their pumping action. So they can help us in reducing the varicocele as well. They can help. Thank you so much. That was all for the day. And with Dr. Himanshu Arora, we will try to schedule more those kind of webinars for all of you in future. Thank you so much for joining.
Thank you so much, ma'am, for wonderful